Ladies and gentlemen, it's a pleasure to welcome you in the International Conference on Information Technology and Communication and Cybersecurity. My name is Mohammed Al-Mili. I am a PhD student at the Faculty of Science in Shuaib Dukani University, El Jadida, Morocco. The subject of my presentation is hybrid mammogram segmentation using watershed and region growing. Now, before we start, let's have a look into the study plan. We start with an introduction, then we talk about the methodology for mammogram segmentation, and then we talk about experimental results, and we finish with the conclusion and future work. First, we need to talk a little bit about the importance of this research and this topic. It's quite important. Because breast cancer is the second most common and leading cause of cancer death among women. According to published statistics, breast cancer has become a major health problem in both developed and developing countries all over the world over the past 50 years, and its incidence has increased in recent years. Early detection is an effective way to diagnose and manage breast cancer, and computer-aided diagnosis systems can play a key role in the early detection of breast cancer and can reduce the death rate among women. The aim of the proposed method is to automatically extract the tumor from mammogram images and consequently build a computer-aided diagnosis system capable of helping physicians in early diagnosis of the breast cancer. Now let's talk about the term mammography. Mammography is the process of using low-energy X-rays to examine the human breast, which is used. This mammography is used in diagnostic and as a screening and diagnostic tool. Digital mammography is a mammography system in which the X-ray film is replaced by electronics that convert X-rays into mammographic pictures of the breast. The method of getting mammogram images is the same for both types. A technician positions your breast between two plates and flattens and compresses them. Then she takes images of your breast from top to bottom and side to side. It can be uncomfortable, yes, but it takes, in general, it takes about 20 minutes. Mammography plays a central role in early detection of breast cancers because it can show changes in the breast up to 2 years before a patient or a physician can feel them. Mammograms can often show a breast lump before it can be felt. They also can show microcalcifications or masses, where calcifications are tiny mineral deposits within the breast tissue. They look like small white spots on a mammogram, while a mass is the same as a lump or a tumor with or without calcification. It's another important change seen on a mammogram. The most significant features that indicate whether a mass is benign or malignant are its shape and margins. The shape can be round, oval, lobular, or irregular. Circumscribed, oval, and round masses are usually benign. An irregular shape suggests a greater likelihood of malignancy. Here, we need to segment and extract the boundaries of tumor for making better decisions. In order to distinguish between benign and malignant masses, mass segmentation in mammograms is a challenging task due to problems such as low contrast, ill-defined, fuzzy, or speculated borders, and the presence of intensity inhomogeneities. These facts complicate the development of computer-aided diagnosis systems to assist radiologists. Now, the question, what is watershed? Watershed technique, it's a technique based on topological interpretation of the image that we get. How is that? The intensity levels represent the height of the terrain that describe mountains and basins. For more details, for each basin we have a hole in its minimum is supposed to be realized, from which the rising underground water spills and fills the basins. Also, as the water rises, the level reaches the border of the basin, and two or more adjacent basins tend to merge together. Next, dams are required for maintaining a separation between basins. These dams also have a job. They are the borders of the regions of the segmentation. Now, let's talk about growing region. Growing region is one of the most common methods for segmentation of medical images due to its performance and simplicity. Also, a region growing approaches exploit the important fact that pixels which are close together have similar gray values. The algorithm starts from one or more pixels called seeds. Then these pixels are chosen as the reference values for the growth. Then region growing expands the selected areas around the seeds to include nearby pixels falling within a threshold range. Now, our method suggests a mass segmentation approach using both the regions of interest in the mammogram and region. Next, we have the raw image contains useful information about a suspicious and very specific area of the image. The method is based on watershed transform algorithm and region growing algorithm. Our method consists of the following steps. First, pre-treatment, then initial segmentation, and finally, final segmentation. Now let's talk about the first step in this method. The first, as we said before, is pre-processing. This stage helps to get clean images for further processing towards segmentation. It's very important because the mammography images have low contrast and obtain more noise. We use something called the median filter. A non-linear spatial filter suggests itself as a very effective noise removal technique that we will adopt in our present study because it helps a lot. To enhance the contrast of mammograms, we propose contrast-limited adaptive histogram equalization technique. This technique is very practical in image enhancement thanks to its simplicity and great performance with almost all sorts of images compared to other methods. Now, as for the second step, called initial segmentation, it is a stage about initially segmenting the original region of interest by means of the watershed transform technique. This technique is applied on the gradient of images and gives an over-segmented image, and this is a problem, so we need to solve this problem. Step number 3 is the solution to the initial segmentation problem. What is this solution? It is the region growing algorithm, which is an effective solution to the problem of over-segmentation. This algorithm stands as the most frequently used and productive method in the field of segmentation applications. We first start with a seed region that the radiologist in charge selects manually. This seed region, which grows iteratively, agglomerates with its similar neighbor regions. The growing process stops when there is no candidate region for the agglomeration. Finally, the contour with the maximum value of average gradient represents the accurate mass contour. An average gradient is represented in the slide shown for you, ladies and gentlemen. Now, as for the material we've worked on, we implemented the approach on digital mammograms taken from Minimia's database, and we've worked on 20 images containing masses. As the present slide shows, we have different contours. Some are drawn by the radiologist in black, and some are drawn by our method. As you can see, the results obtained based on our method are very close to the ones drawn or given by the radiologist, which means our method is working, effective, and going the right direction. Also, as the present slide shows, you can see that our approach is giving very good results compared to other methods. Okay? Some of the results our approach gives are far better than the ones given by the approaches that we have on the slide. This means that our approach is good, is working. We may have some limitations. That's okay, that's normal in the process of developing anything, and we are working on that to make it even better and even more productive. As a conclusion, our study uses a hybrid method based on for boundary detection based on watershed and region growing. This method was tested against data taken from Minimia's database. For the future, we're going to see how to make our research more descriptive and informative. Ladies and gentlemen, thank you for your attention.